Hello, today I'm going to cover our growth and development assignment for adolescence. Adolescence is a period during which the person becomes physically and psychologically mature and strives to develop their identity. Once adolescence is complete, one should be ready for the responsibility of adulthood. However, the length of adolescence is culturally determined. The age range is variable. Adolescence is typically between 12 and 18 years old for Canada. Physical changes. Puberty is the first stage in adolescence. Sexual organs begin to grow and mature. The significant events of puberty include the start of menstruation for women and ejaculation in males. Puberty starts sooner for girls, typically between 10 and 14 years old. For boys, puberty occurs between 12 and 16. For males, the changes include increased sweat, hair, and primary sexual characteristics, such as enlargement of testes and the penis, voice changes, and the first ejaculation, which usually occurs around 14. However, sexual maturity is not achieved until 18. For males, their maximum height is often reached at about 18 to 19 years old, and their growth spurts usually starts around 14. Although everybody is different, weight gain during this time is approximately 32 kilograms, and the increase in height is approximately 41 centimeters. Female changes through puberty include the first noticeable sign of the start of puberty for females is typically the breast bud. However, genital hair may proceed with this. The most significant milestone for females is menstruation, which occurs typically 2 years after the breast develop. Ovulation may not occur until 1 to 2 years after the start of their menstrual cycle. Sexual organs reach their adult size at about 18 to 20 years old. The maximum height is often reached at about 10 to 15 years old, and then the growth spurt starts at about 12 years old. The average increase in height is approximately 24 centimeters, and weight gain is around 25 kilograms. However, of course, this is very individual. Behavioral changes in adolescence for both males and females are due to exploring greater independence and discovering their identity. At about age 15, the need for independence combined with the need for family support sometimes creates conflict within. Conflicts can lead to risk-taking behaviors. It is important to educate adolescents on safe sex practices, alcohol, cannabis, and tobacco consumption. Other behavioral problems related to nutrition and self-esteem among adolescents include obesity, anorexia, and bulimia. The 3 leading causes of death in the 10 to 24-year-old age group is unintentional injuries such as motor vehicle accidents, suicide, and cancer. Females experience more depression and suicidal ideations than compared to males. However, males act on their thoughts 4 times more often. According to Erickson, the psychological task of the adolescent is establishment of identity. This stage, commonly called identity versus role confusion, occurs when this individual explores their own personal identity. Role confusion can arise at this time, and sometimes questions about sexual identity can arise. Usually during this time, adolescents cope by forming cliques. This enables individuals to surround themselves with like-minded people to reinforce their own developing identities. The adolescent needs to establish a self-concept that accepts both personal strengths and personal weaknesses. It is reasonable to experience temporary difficulty with developing a positive self-image, facing physical challenges or illnesses. Those who have difficulty forming relationships or do not fit into the adolescent cliques may develop poor self-image, and this can lead to low self-esteem. Gay, lesbian, and transgender adolescents can experience a great deal of confusion during this period. Adolescents are also in the formal operational stage of stages of cognitive development, between 11 and 15 years old. At this stage, the adolescent can think beyond the present and are highly idealistic. They become more informed about the world and the environment that surrounds them, such as becoming more concerned with global problems or environmental issues. Spiritual development of the adolescence is thought to be in the synthetic, conventional stage, according to Fowler. In this stage, the adolescent encounters different groups in society, and this provides the adolescent with options regarding spiritual and religious matters. Generally, an adolescent can see that various religions and practices have more similarities than differences. For adolescents, moral development starts at the first stage, and this is the conventional level. At this time, individuals may want to abide by societal order and existing laws. Many discard the values they adopted from their parents to favor those they consider to be more suitable. Post-conventional, or principle level, they start to question the rules and laws of society, especially if their personal views conflict. However, not all adolescents, or even adults for that matter, proceed with this post-conventional level. Thank you for watching. This video was brought to you by Dina, Michelle, and